Now, your health, your safety. This is ABC7 News.
I'm Kristen Z. Welcome to our daily special called Getting Answers. We're asking experts your questions every day at 3 to get answers for you in real time. So today we're talking about the current job market and what to do if you're looking for a job. But first, we will talk with the Deputy Health Officer of San Francisco, Public Health Officer. So post your questions to either guest on our Facebook live stream, YouTube Live, or check out our Instagram stories to submit a question. So before we do that, let's recap the changes now in effect in 6 Bay Area counties. These counties, of course, Alameda, Contra Costa, San Francisco, San Mateo, Santa Clara, and Marin. So these were effective as of Monday. These are open and allowed. All construction projects, real estate transactions, some child care camps, educational and recreational programs, outdoor businesses like nurseries and landscaping, certain outdoor recreational facilities like skate parks and athletic fields, not all, so we'll explore that, golf courses, and all businesses must update and create social distance protocol as part of the reopening, of course. Not allowed still, including public and private gatherings of any size, playgrounds, picnic areas, gyms, dog parks, shared spaces that don't permit physical distancing. Bars and restaurants are takeout only, funerals up to 10 people, and non-essential travel. That is on the local level. But Governor Gavin Newsom announced statewide easements, restrictions, relaxing them, that will start on Friday. And what does that mean? Well, that includes curbside pickup for some retail, including clothing, bookstores, music, toys, sporting goods, and florists. And remember, between the county and the state, the stricter rules do apply. It is complicated. So joining me now is an infectious disease specialist and current Deputy Public Health Officer of San Francisco, Dr. Susan Phillip. Dr. Phillip, thanks so much for joining us today.
Thank you. Happy to be here.
I'm so happy you're here because there's so much to unpack, and I watch almost every single one of those news conferences, and there's still confusion. So right now, we just heard Mayor London Breed about an hour ago saying San Francisco City and County may not open the stage 2 businesses in the same way or perhaps at the same pace that Governor Newsom mentioned, that we might go a little bit slower here. Why?
Well, I think, what you're saying is exactly right. When there's a discrepancy, the stricter rulings would be in place. So for the governor and for the state, they may be deciding to loosen, as you said, some of the current restrictions on retail, allowing for curbside pickup, et cetera. And here in the Bay Area, I think we are, again, speaking very clearly with all the other Bay Area health officers and thinking about everything that has been achieved with really all the sacrifices and all the work that all the residents of the Bay Area have been making, and wanting to make sure that we have everything in place as we move forward, because the last thing we want to do is squander all the hard work and all the sacrifices that people have made. Mm-hmm. So we are going to proceed. We are talking about the things that have to be in place, but we're not ready to proceed at the same rate that people might expect or hope. We are moving, but it is going to take a little bit longer.
Well, I know you're always guided by the numbers, right? So do our infection rates or our case numbers or hospital numbers warrant that we move a little more slowly, or is it simply that we are just more cautious?
Well, I think that our numbers overall are quite good. And again, that has come with a lot of blood, sweat, and tears from listeners right now and from all the people across the Bay Area who really have put aside, their own interests, their own things that they'd like to do and the people they'd like to be with, and have sacrificed a lot to get us there. So our numbers look good compared to some other parts of the country in terms of what we've been able to accomplish, and particularly in looking at our hospitalization rate and being able to keep that very level. So if you just looked at the numbers, you might wonder, well, why not just loosen up now? But really what we know is that we've got to have some core pillars in place before we move forward. Mm-hmm. One of those is having testing, and you have heard the mayor announce how we have expanded testing over the past several days and week. Mm-hmm. But we haven't had the ability to do that as much as we want to up until a couple of weeks ago. The other piece that we want to really expand, everyone has heard probably now about this idea of investigating cases and doing contact tracing in order to make sure that people can isolate and not infect others unknowingly. We are scaling up our ability to do that. And then, we've been working so hard for many months to really make sure that our hospital systems across the Bay Area are ready. And, while we're there every day, that we can continue to shore that up and also figure out how we can allow for more of our usual care to happen, all the elective surgeries, all the things that we've delayed. We want to incorporate that back in and still allow for capacity for people who might need care for coronavirus. So we're building all of these things over this month and seeing how we do with those measures and those metrics. And then we'll feel even more confident when we are able to move into the next phase.
All right, I want to dive more deeply into testing in just a few minutes. But right now, I think it's really important because first and foremost on people's minds is what really is going to change come this Friday. What's going to be open? Phase 2 does begin. But however, given the Bay Area counties, SIP, continuing through the month of May, what practically changes? Like if I'm in San Francisco walking around, what will I see different in terms of what's going to be open now that maybe wasn't before? Or is it really not going to be that different?
Well, in terms of this Friday, things are not going to be that different. But in terms of starting on Monday, 2 days ago, it would be different than it was the prior week. Because you have seen how the mayor has announced and Dr. Colfax, Director of Public Health, has announced that we are opening, outdoor activities more. We're opening businesses that can operate outdoors. And so there's much more of an encouragement to be able to do those outdoor activities, which I know is welcome by everyone. But as far as Friday itself, I don't think that'll be the day in San Francisco or the Bay Area that we see the big difference. But those days are coming, and we will be seeing that gradually over time.
All right. I want to fold in a question here because a lot of people ask about this. Kathy McFall wants to know why can't dog grooming, with no human contact at all, why are we not being allowed to reopen?
Yeah, I think that is a reasonable question. One of the things, again, we are really focusing on businesses that can primarily open outdoors and open and operate outdoors primarily, and usually grooming businesses that doesn't apply. The other thing is, there usually has to be about 6 feet between people to hand off the pet or to stay with the pet and make sure that the animal is calm and able to be groomed. It's interesting, but there also have been reports that coronavirus can be transmitted to pets, and so there is a recommendation to also not have pets be close in proximity to each other that are not part of the same household.
Sure.
So I think that it's a reasonable question. I think there's a question about a lot of services that people think could be open, and we're going to look at all of them. And I think as a region, we'll move forward at the speed of safety, as we say. We want to do it as quickly as possible, but we don't want to lose all the gains that have been so hard won.
I should point out, though, the number with pets is really low, the number of cases. I want to move on to another question from Ann Nicholson Canziani. She says, when will pools open up at apartment complexes? And here's my question. Is there not a way to do that, but just ensure that, maybe you limit the pool, it's a big pool, limit it to 5 people, people can swim laps. It's not the water that's the problem and transmission point. It's just the, being physically apart from each other. Can that be maintained?
That is true. It is not the water itself. It's being in proximity, and I think that there are challenges around maintaining that distance, particularly if it's children or other groups that might be more likely to congregate together. I think there probably are ways and rules that could be rolled out, and I think part of what we're doing over the next few weeks is to really determine what do those rules look like, and how would we do that safely when the time comes. We are going to be in this different world. It's not going to be back to normal for a long time until there is a vaccine, until the majority of us have been able to get the vaccine and benefit from it. So we are going to have to think of these rules, and so I think the things that are being suggested about pools make a lot of sense, and over time we'll incorporate those changes.
All right, Dr. Phillip, we're going to take a short break here on the air, but we can continue this conversation on our live streams, including Facebook Live. And of course, we'll be back on air in just a couple of minutes.
And we're in commercial break for 2 minutes.
All right, we are so happy to be able to have San Francisco's Deputy Health Officer, Dr. Susan Phillip, with us today. Susan, let's just continue plowing through people's questions. They're wondering when youth sports might be allowed again in San Francisco. I know for all the folks who are sad about, Little League not happening, is this going to go on all summer or into the fall with school sports as well? What do you foresee there?
I think that is a tough one. I think bringing groups of children together that don't live in the same household, we just don't know that we could do that safely at this point. And in fact, we think that would be a real challenge to limit spread of the virus in that situation. So it's the same considerations as for groups of any age. Bringing them together right now is just not safe. So we know it's very disappointing for a lot of kids and a lot of families and adults as well to not have that ability. But it's something that at the moment we don't feel is safe to restart.
Okay, Monty wants to know, does the virus always raise people's temperature? And what is the percentage of people who get fevers if they have COVID?
That is a really great question. I think definitely in the beginning, when we were first learning about the virus back in January and first concerned about it coming to the United States and to San Francisco and the Bay Area, we really were thinking about the big three symptoms. We're thinking about fever and cough and shortness of breath. And what we have learned over the last short few months is that the symptoms can be very broad, and not everyone has a fever. The symptoms can range from nasal congestion to muscle aches to even just fatigue. So I think one thing that's important to know is for people in San Francisco that have any of these broad symptoms, and you can see them at SF.gov or on the SFDPH website, you can go to City Test SF.
All right, we're going
to
back
get
on the air, Susan. Hang on one second. And we're back with San Francisco's Deputy Public Health Officer, Dr. Susan Phillip. Susan, we're getting a lot of questions in, so let me just get a few of them started. From Instagram, someone asking, when can we have more gatherings with friends at home? And this is also a timely question because we have Mother's Day coming up this Sunday. What is your advice?
Well, the advice, unfortunately, for Mother's Day, for graduations that people are hoping to celebrate, is really that it's too early to get together with families outside of your own household. And I know it's been frustrating. It's a long time since we've been able to see our friends and our extended family. But for now, the recommendation is really to continue to do that at a distance through Zoom or through other video conferencing and other ways of getting in touch.
All right, from Instagram, when are high-risk employees going back to work?
So I'm not sure what is meant by high-risk employees, but people who are older or who have other preconditions other existing conditions that may not allow them to go back. I think it would be on a case-by-case basis, depending on their workplace and the type of work that they do. And there are some people who have to work. They've been doing essential work this entire time. And again, something that Mayor Breed announced was that San Francisco is offering testing to these workers at the City Test SF test sites. And you can find out more information about that at SF.gov or at the SFDPH website.
Yes, actually, that does set up my question, which is it true that anyone who either lives or works in San Francisco now can get a test? And when we say test, do we mean they can get the antibody test or the PCR test?
Thank you. Yes. So it's the PCR test that is offered at these sites, and it's available to any resident in San Francisco who has any one of the symptoms that can be compatible with COVID, and it's very broad. It can be muscle aches, fatigue, congestion, so it doesn't have to be a specific cough, fever, or shortness of breath. And it can be for anyone who works, who's an essential worker that must go to work, and this includes our healthcare workers, our first responders, but also people that are manning our grocery stores, our delivery drivers, all of those people that have kept our ability to have our way of life going, they can get tested whether they have symptoms or not. So again, go to SF.gov and look at that. It's at the City Test SF testing sites, or you can get tested through your providers as well.
Okay, so I would be eligible. I work here in San Francisco, and I'm in the news business, so I continue to work. Okay. How many testing sites do you have now in San Francisco?
So there are 26 testing sites throughout San Francisco, but 6 of them are operated by the Department of Public Health. There are 4 that are in DPH clinics and the 2 City Test SF sites. One is at Pier 30 and 32 on the Embarcadero, and one is at 7th and Brannan Street in Soma.
Okay, I'm moving now from testing into therapeutics. And as you know, Gilead's drug remdesivir is a potential therapeutic that can maybe shorten the amount of time that you're suffering from COVID. But I'm hearing that, UCSF is one of the many hospitals across the country that applied for like a federal assistance in terms of getting it, but it's been denied along with all the hospitals on the West Coast. And none of that remdesivir from the federal government anyway is getting to us. Do you know anything about that?
I don't have specific insight into that, but I do know that our state colleagues are working very closely with the federal government and with regional health entities as well to try and work on that.
All right. I want to also ask you now, Mayor Breed addressed the city's continued attempt to step up the efforts to make sure everyone is housed in San Francisco and the unsheltered are also moved to an environment that doesn't put them in a high density, higher risk situation. I want to know how the city is doing in terms of placing people. Are you on track, and when would you actually have just about everybody in a good situation? What is the percentage?
Yes, this has been a priority of the city, and I will tell you that there are other departments, not public health, that are primarily involved in that, including the Human Services Agency and Homelessness and Supportive Housing. But DPH plays a role in the health aspects of it. So as we find people, when we're talking to them who've been diagnosed with COVID or who contact to someone who has COVID, and they're not able to safely isolate in their own homes, or they can't quarantine and be apart from other people, then we are able to refer them to one of these, what we call isolation or quarantine sites that provide sort of supportive services in addition to a place to stay. So we have been able to do that for the people that need it, and that's been our main priority in this avenue as the Department of Public Health. That's the part that we're responsible for. Are we making sure that the people that need this to fulfill our public health work are able to get it, and that has been the case.
All right. Of course, we're also hearing the homeless being housed in hotels are getting drugs and alcohol delivered to them by the public health department. I'd like to hear why you feel like that's an essential thing to deliver. I know you face competing needs for, delivering food to seniors and drugs, medication to seniors and those who are homebound. Why this choice?
Yeah, so thank you for that opportunity to talk about it. So we were just talking about how people are placed into these isolation and quarantine hotels because it allows them to stay isolated, to be able to not inadvertently pass their infection or develop infection and then transmit it to other people. So they are really doing they're doing work in partnership with us for public health good by doing that. We also know that a small percentage of people have substance use orders where they require some amount of alcohol, or they become actually ill. They become shaky, it can have seizures, and so on. Mm-hmm. So for a very small percentage of people in these isolation and quarantine hotels, under the supervision of medical doctors, they are given small amounts of alcohol in order to not develop symptoms of shakes. So this is a philosophy that we have always had in the city and in the Department of Public Health. It's called harm reduction. So we want people not to suffer when we are working with them and have them in the hospital for some reason, or we have to have them in these INQ hotels. The doctors always offer them treatment or other alternatives. And, by working with individuals, we have a better chance of getting them into substance treatment programs and being able to have them also isolate and be able to successfully prevent transmission of COVID to others. So we see this as very consistent with our work.
So the city says taxpayers are not paying for this, so who is paying for it?
Well, there was a very small amount that was through city funds, and there are primarily private donations, and donations are the way forward that the city and the department is looking to subsidize this. And again, this is a harm reduction measure for a very small number of people that actually need this in order to keep the whole public safe.
All right. Dr. Susan Phillips, we're going to take a short break on the air, but continue this conversation over on our live streaming platform, so you can join us there if you'd like. Take a short break.
In commercial break.
Our other guest? Oh, okay. Do we have time for anything at all? I've got one more question. Okay, real quickly. Tennis courts, why are they not allowed in San Francisco but okay in Marin and Contra Costa County?
Well, in San Francisco, we've said the ball is shared, and we really, again, are trying to prevent any possible route of transmission.
All right, so no longer are the counties on the same, necessarily operating with one voice?
This is my understanding from San Francisco. I can't speak to Marin, so I would have to look into that and get back to you.
Okay, thank you. That's just been a little confusing for Bay Area residents, but I really appreciate you spending all this time to clarify things for us. Best you can. I know it's not perfect, but clarity is, and straightforward.
Yeah, we're learning every day. Thank you for the opportunity.
Bye.
Bye-bye.
All right, we are back with our second guest. I thought there was one more block with Susan. Otherwise. Oh, I see. I see. Okay. Gotcha. Because there were things that I would have gotten in had I known there was not another block. You know what I mean? So let me know if you change something like that as well. I know you're trying not to bother me too much, but yeah, thank you. Hey, how's it going? Julia Pollock? Is it Pollock? Give me a thumbs up. I can't hear you. Is it Pollock? Okay, thank you.
Yes, Pollock's correct. Thanks.
Great. So how much time do we have with her? And it's all her, and that's it, and one block only, yes?
Seven, 6, 5, 4, 3.
All right, thanks for coming back with us. Jobs on the minds of a lot of people right now as we continue under shelter in place. Today's easing could help some Bay Area families, but a lot of questions are certainly still out there. So joining me now to talk about the state of the job market is labor economist at ZipRecruiter, Julia Pollock. Thanks for joining us. Of course, 4 million Californians filing for unemployment just in the past month. I'm almost a little afraid to ask, what is the job market like for job seekers right now? I hope there is a little bit of good news in there somewhere.
Well, it's a tough job market right now. Many of the gains that we saw over the past decade that increased job seeker leverage have now been wiped out overnight. Job postings are down 47% overall, in some industries even more than that. But there are industries where this crisis has actually caused a surge in new users and in sales, and where there are employment opportunities out there.
All right, I do want to ask you, in a majority of states right now, people receiving expanded unemployment insurance, government insurance, and those benefits can exceed average earnings. So if you are getting those benefits, should you apply for a job now or wait until they run out?
You should apply for a job right now, because the labor market is only going to become more competitive for job seekers over the coming months. While the overall number of opportunities has fallen, the number of job seekers who will be flooding this market could be as many as 8 to 10 million in a couple of months. And so it'll be much harder to get a job then. Apply early. The expanded unemployment insurance benefits, those are not a salary, they're a safety net. And so people should really apply for jobs now. Especially with fewer overall opportunities out there, it could take longer to find a good match. So starting early on your job search is really key.
All right. In which sectors and areas are you actually seeing an increase in help wanted ads?
So there are some industries that are pretty, recession-proof and that have very, very good growth prospects over the next decade, where we will continue to see growth and where we're still seeing pretty robust hiring. Software developers, information security or cybersecurity analysts, e-commerce specialists, all of those people in high demand, and their importance has only grown as this crisis has accelerated this sort of digital revolution. And then there are places where this crisis has created a real need, like in grocery stores and delivery drivers services. And we're seeing a lot of opportunities there too.
All right, if job seekers are browsing through job ads, how can they be sure that the employers are actually still hiring?
Well, there are two ways. At ZipRecruiter, we've added an actively hiring during COVID banner to jobs where the employer has verified that they're still extending offers. But the other way is to look at job postings by the date when they were added. So if an employer has added a job posting in the last week or two, knowing everything that we know about this coronavirus crisis, you can count on it that they are hiring. You can also look at language in the job postings. So the number of job postings, the share of job postings that have words like urgent or immediate start in them has gone up. And that shows that employers are serious and that they will probably reduce the time to hire. They won't, put you through the ringer and make you go to millions of interviews because they really need someone on the job now.
All right, what should you do if you want to work, but you also need to look after children due to their school closures being at home?
Well, that's a tricky situation for many Americans right now. And, it's not an easy one to solve. But the share of jobs on ZipRecruiter that are temporary or part-time or that offer flexible schedules has risen. And so has the share of jobs that offer the opportunity to work from home or work remotely. And so you could look for those kinds of jobs that allow you to do the time when you're available.
And do you think that is a trend that's going to continue even after we slowly ease up and get out of this crisis?
Oh, definitely. Remote work is here to stay. Many companies will face, a huge cash crunch and are going to cut costs. One way they'll do that is by reducing their office footprints. They have now made the investment in remote work technology. They have come up with the practices and procedures for monitoring employees remotely. And many have found that employees are actually often more productive in this environment. The majority of employers that we surveyed said that they are more productive at home. A large share prefer working in the office. Increasingly, we'll see employers provide workers with the opportunity to choose, and people will self-select into the environment where they are most productive and happy.
All right, real quickly, we have like 20 seconds, but what are your favorite search terms to use on your platform?
Oh, I like looking for things like work from home, flexible schedule, but also terms like venture capital backed to find jobs that are the next big thing, where investors think this is really the place to be.
Got it. All right, Julia Pollack from ZipRecruiter, thank you so much for coming on today. Appreciate it.
Good talking with you.
All right, we'll take a short break and be right back.
We're in break.
All right, hey, Julia. I've got one more question, and Francine wants to know that she has exhausted her UI, and she just got a job before COVID-19 in her field as a school teacher. She doesn't really have a question there, but I imagine you're facing others. You've heard about that happening to a lot of people. So any advice?
Right, so there are lots of people who were on unemployment benefits when the crisis struck, or who had just started their job search and who weren't working previously. And this the CARES Act actually does provide some expanded benefits and relax the definitions and requirements. So some people are still able to get benefits or to extend the benefits that they were receiving before.
All right, Julia, thank you so much. Really appreciate the time. Take good care.
Okay.
All right, how much time do we have before we come back on air?
1 minute.
Oh, we have 1 minute. Okay. Okay, and where is that recap? Okay. All right, folks. Thanks for joining us today on this show. Hope you learned something from the San Francisco Public Health Officer, the Deputy Officer, Susan Phillip. Yeah, it's interesting. It remains to be seen whether San Francisco will move a little more slowly than most of the state in terms of easing up restrictions and allowing businesses to reopen. And even when they reopen, it sounds likely that there will be more stringent guidelines and the protocol might be a little different. So it'll be interesting to see in the weeks ahead how that all plays out. All right, we're going to come back on air on
10,
ABC7.
9, 8, 7, 6, 5, 4, 3.
All right, before we go, we just kind of want to wrap up where things stand right now in the Bay Area in terms of the restrictions. These counties impacted: Alameda, Contra Costa, San Francisco, San Mateo, Santa Clara, and Marin. So openings this week, as of this Monday, these are allowed: construction, some real estate, some childcare, outdoor businesses, certain outdoor recreational facilities, and golf were listed among those. Not allowed still, including public and private gatherings of any size, playgrounds, picnic areas, gyms, dog parks, shared spaces that don't permit physical distancing, Bars and restaurants are takeout only, funerals up to 10 people, and non-essential travel still barred. Moving on to the state level, as you know, some retail can start opening up Friday if they follow certain guidelines. Those guidelines generally including curbside pickup for some retail like clothing, bookstores, music, toys, sporting goods, and floors. So, you know, you won't be able to go in and put on a dress or try out the dressing room. It's going to be curbside pickup. And remember, between the county and the state, the stricter rules apply if there's a difference between your county rule and the strict rule. And that's going to do it for now, but we thank you so much for joining us on this interactive show, Getting Answers. We'll be here every day at 3 o'clock on air and on live stream answering your questions. I'm sure you'll have more questions after the governor gives us more details tomorrow on the Phase 2 reopening. You can always join us on Facebook Live, YouTube Live, and ABC7news.com. All right, thank you.